So let's study Agad Tantra using some MCQs. Part 1. According to Sushruta, Sthavara Visha Adhisthana are dash in number. So options are 16, 10, 8, 13. So let's see how Sushruta explain the Sthavara and Jangama. So Visha Adhisthana is classified by Sushruta Acharya into Sthavara and Jangama. Sthavara is Adhisthana are 10 in number and Jangama is 16 in number. So here the answer is option B, 10 Visha Adhisthana. So Sthavara Visha Adhisthana's are 10 sources from which a Sthavara poison may be obtained are Moolam, that is roots, Patram, leaves, Phalam, roots, Pushpa, flowers, Twak, bark, Ksheramilki, exudations, Sara, Pitta, Niryasakam, Kanda, bulb, and Dhadu, a mineral or metal. So these are Moolam, Patram, Phalam, Pushpam, Tvakshiram, Sara, Evacha, Niryaso, Dhadavaschaiva, Kandascha, Dashamaha, Smritaha. So these are the 10 sources from which a Sthavara poison may be obtained. Now, according to Sushruta, Jangama Visha Adhisthana. Jangama Visha Adhisthana is 16 in number. So, an animal poison is the Jangama Visha. It is usually situated in the following parts. Drishti, sight, Nishwasa, breath, Damshtra, teeth, Naga, nails, Mutra, urine, Purisha, stool. Shukra, semen, Lala, saliva, Artava, that is menstrual blood, Mukha, Damsha, stings. Vishardita, belching, Tunda, anus, Asti, bonds, Pitta, bile, bristles, Shuka, Shava in the dead body of an animal. Tatra, Drishti, Nishwasa, Sam, Nishwasa, Damshra, Nagamotra Purisha, Shukra, Lala Artava, Mukha Samdamsha, Vishardita, Tunda, Asti, Pitta, Shuka, Shavani, Idi. Dash is one of the ingredients of Dushi Visha Adhisthana. Mamsi, Amrita, Shundi, Triphala. Mamsi is the ingredient of Dushi Visha Adhisthana. So let's see what is Dushi Visha Adhisthana. And this is explained in Ashtanga Hridaya Uttarasthana, chapter 35, Visha Pradisheda. Vikalyo, Dhyamagam Mamsi, Rodram Ela, Suvarchika. Kudannadam nadam kushtam yeshti chandana ghairikam dushi vishari namna ayam na cha anyatrapi varyate. So the ingredients are pippali, dhyamaka, mamsi, rodra, ela, suvarchika, kudannada, nada, kushta, yeshti, chandana, ghairika. And these all are converted into nice paste with water and consumed in suitable dose along with honey. This cannot be avoided even in others' poisoning. Which of the following yoga is for the treatment of the Gara Ubahada Bhaga? And that is Vadi Yoga. Amrita, Nadakana, Padoli, Chavya, Chitrakan, Vaja Mustavirangani, Takra Koshna Ambu, Mastubihi, Pipedrasena Va Amlena, Garobahada Bhavagraha. So this is mentioned in Ashtanga Hridaya Uttarasthana, chapter 35, Visha Pradisheda. Powder of Muruva, Amrita, Nada, Kana, Padoli, Chavya Chitraga Vaja Mustavidanka. And Anupana is, these are mixed with either buttermilk, that is takra, ushnambu, koshnambu, warm water, mustard, water of curds, and meat soup, that is mamsa rasa or a sour liquid, amla rasa. It should be consumed by the person having digestive fire destroyed by artificial poisoning or Gara Visha. Tobacco is a dash poison. It is a cardiac poison. Option C. Tobacco is considered a cardiac poison. It significantly harms the heart by increasing the blood pressure, narrowing artery, and raise the risk of heart attacks and strokes due to the chemicals within tobacco smoke, particularly nicotine, which directly impacts the cardiovascular system. So these are the cardiac poison mentioned. Some examples: econic, that is our Valsanaba, nicotine Tamraparna, Oleander caravira, and digitalis Kritpatri. Which of the following is a spinal stimulant poison? So example given are Ahifena neurotoxin, Kuchala spinal poison, Vatsanaba cardiac poison, Arca irritant poison. So spinal poison is Kuchala. Kuchala is Strychnos vomica. Answer is option B. Which of the following drivya is not used for Hridayavarana? Gomayarasa, Kshaudra, Supakwa, Ikshu, Mudga Yusha. Answer is option D, Mudga Yusha. So what is Hridayavarana? It is one of the most important Chikitsa Upakrama mentioned by Acharya Charaka. The drugs used in Hridayavarana treatment is mostly Ojo Vartaka and Pitta Shamaka. Hridayavarana drugs mentioned are Madhu, Grita, Majja, Paya, Ghairiga, Gomaya Rasa, Supakwa Ikshu Rasa, and Kaga Nishpidya Rasa. So let's see the sloka. Ado Hridayam Rekshatasya Avaranam Pibet Yadhamayam Madhu Sarpi Majja Ubayoga Madhu Sarpi Majja Payo Ghairikam Ada Gomayarasam Va Ikshum Supakwa Madhava Kagam Nishpidya Tadrasam Varanam Chagadinam Va Asrak Basma Mridam Va Pibedashu. In the second stage of Visha Chikitsa, Hridaya, heart, should be protected and an avarana should be made according to the availability of the drug. Madhu, honey, ghee, clarified butter, majja, bone marrow, paya, milk, gairika, red ochre, gomaya rasa, juice of cow dung, well-boiled sugarcane juice, that is the supakwa ikshu rasa, or the juice of squeezed out meat of crow, that is the kagam nishpidya rasa, should be given to the patient for protecting the heart. And patient can be treated immediately with the blood of god, etc., ash or mud diluted with water to drink. In Visha Chikitsa, Kagandadi Yoga is indicated for dash Chikitsa, Vamana, Virejana, Mritu Sanjeevana, Upadana. Answer is option C, Mritu Sanjeevana. So treatment in case of hanging and drowning, we use the Kagandadi Yoga. Kaganda, Surasa, Gavakshi, Punarnava, Ayassi, Shirisha Falehi, Udbadda, Visha Jalamrde, Leba Aushadi, Nasya Panani. That is, if the patient appear to be dead because of Udbandana, that is hanging or poisoning or drowning in water, Jalamrita, then the portion comprising Kakanda, Surasa, Gavakshi, Punarnava, Vayassi, and fruits of Shirisha should be administered in the form of leba along with aupati. Aupati means it is the application of the paste over the head after making incision in the form of Kakapada or paw of crow. Nasya and Pama for his revival, that is Mrita Sanjeevana. According to the Shargandhara, Vishaguna are dash in number 8, 10, 7 or 9. Answer is option A, 8. So we can see the Vishagunas. Charaka mentions how many? 10 gunas: Lagu, Ruksha, Ashu, Vishada, Vyavayi, Tikshna, Vikashi, Sukshma, Ushna, Anirdeshya Rasa. Sushruta mentioned Abaki, not Anirdeshya Rasa. Yoga Ratnavali also Abaki. And Ashtanga Sangraha Avyakta Rasa plus Abaki. Ashtanga Hridaya is Avyakta Rasa plus Vishama Paki. What about Shargandhara? Shargandhara, there is some difference. Only 8 gunas. Vyavayi, Vikashi, Sukshma, Chedi, Madavaha, Agneya, Jivitahara, Yoga, Vahi. According to Sushruta, Mula Visha are dash in number. The root poisons or Mula Visha are 8 in number. Tatra, Klidaka, Ashwamara, Guncha, Sugandha, Gara Garaga, Gargaraga, Kara Khada, Vidyuchiga, Vijaya, Idi Ashtau Mula Vishani. Daha Upakrama is indicated for dash Visha. It is answer C, Tvak Mamsagada Visha. So treatment of the first stage of Visha, Tvak Mamsagadam Daho Dahati Visham Sravanam Harati Rektat Pedam Vamanehi Sadhyo Hared Viregehi Dvidiye Tu. Agni Karma causes burning of poisoning located in the skin and flesh. So, the burning of the poisoning. Sravana, drug used to cause exudation of the liquid, helps in flowing out of poison from the blood. And Vamana help in eliminating poison which has been taken orally. Second stage of poisoning, Virechana, plays a definite role in eliminating the Visha from the body. Shodhana Chikitsa protocol for Dushi Visha. It is Dushi Visha Chikitsa is Svedana, Vamana Virechana, and Dushi Vishari Agada. So answer is option D. First is Svedana, then Vamana Virechana. So treatment of the Dushi Visha as in Ashtangardaya Uttarasthana, Dushi Vishartam, Surasvinna Murdvam cha Adascha Shodhitam, Dushi Vishari Magadam Lehiyen, Madhuna Aplutam. So patient of Dushi Visha should be administered Svedana or sudation therapy, then Vamana, MSS and Virechana or purgation therapy. This is followed by Lehena or licking of the Dushi Vishari Agada mixed with honey. So Dushi Vishari Agada we already discussed. According to Sushruta, which of the following is one of the Upadrava of Dushi Visha? Jvara, Pandu, Koda, Shwasa. Answer is option A, Jvara. तेन पाण्डुः कृशो अल्प अग्नि कासश्वास ज्वर अर्दिदः वायुना प्रतिलोमेन स्वप्रचिन्दापरायणः दीनवाग् दुर्बलो अलसः महोदरयकृत् प्लीः शोभवान् सतत आत्मादः शुष्कपादगरः क्षयी स्वप्ने गोमायो मार्जार नकुल व्याळ वानरान् प्रायः पश्यति शुष्कांश्च वनस्पति जलाशयान् मन्यते कृष्णमात्मानं गौरो गौरं च कालगः विकर्णनासानयनं पश्येत् तत् विहदे इन्द्रियः. In Ashtanga Hridaya Uttara, chapter 35, Visha Pratisheda. By that, the person become Pandu, that is pale, Krisho emaciated, Alpa Agni, weak digestive capacity, Kasa Shwasa Jvara Ardida, suffer from Kasa cough, Dyspnea Shwasa, Jvara fever, Vayuna Pradulomena, upward movement of Vada, Swapna Chinda Parayana, so spending more time in sleeping and worrying. Mahodara, suffer from enlarged abdomen. Deenavak has timid, feeble voice. Durbala alasa, debilitated, lazy. Yagarplihi, shopavan, develops swelling. And sadada atmadaha, distension of the abdomen, always. Shushka, padha, karaha, kshay, dryness of the feet and hand, emaciation. Generally, Swapne dreams of seeing Gomayuja called Marjara, that is cat, Nagula, mongoose, Vyala, snake, Vanara, monkey, Shushkamscha, Vanaspati, Jalashayan, trees and reservoirs which are dry. Manyade Krishna Matmanam Gauro Gauram Chakalagaha. Think that he has become black instead of his original white color, or he has become black instead of his original black color. So I think that he has become white. Vikarna nasa nayanam pashyat tat vihidendriya. Seeing his ears, nose, eyes, etc. as rough and distorted. So he has become white instead of his original black color. Now next, according to Rasa Tarangini, the Upavishas are dash in number. So answer is option D. Upavishas are 11 in number. So let's see which are the Upavisha. It is Nuhi Kshira, Euphorbia nerifolia, Arca Kshira, Calotropis procera, the Turabicha, Karavira, Nerium, Inticum, Langali, Gloriosa, Supraba, Vichaya or Banga, Cannabis sativum, Visha Tinduga Bicha or Kubilo, Strychnos naxvomica, Rejacum or Jayapala, Croton tigillum, Balladaga, Semicarpusana, Cardium, Ahiphanum, Papaver, Somniferum, and Gunja, Ebrus precatorius. These are the Upavishas mentioned in Rasa Tarangini. Dash is a toxic principle present in Vatsanaba. It is aconitin. Vatsanaba, it is known as Aconitum ferox. It is a highly toxic plant and it contains potent neurotoxins and cardiotoxin. It is considered as a Mahavisha or highly poisonous plant in Ayurveda. And Sanskrit name is Vatsanaba, botanical name Aconitum ferox, family Ranunculaceae, English name is English monk's foot. Toxic part is all parts, mainly root, and type of poison is cardiac poison. And Rasa is Madhura, Guna, Lagu Tikshna, Vyavayi, Vikashi, Virya, Ushnavirya, Vibhaka, Madhura. And Rasa Vakpada enumerated 8 stages of aconic poisoning and described symptoms are Tvak Vikara, 2nd stage Vebadu, 3rd stage Daha, 4th Vigradavastha, 5 Phenodgama, 6 Kandabanga, 7 Jadada or coma, and 8th is Marana. According to Rasa Tarangini, Vatsanaba is a, it is a Kshubha. So what is Kshubha? The synonyms of Vatsanaba in Indian medicine are Sindhuvara, Nirgundi-like leaves, Gostanaghara, tuber shape is like cow's nipple, Yat Parthiva na Tarovritti, does not permit other plants to grow nearby, Pandura, pale colored tuber, Neel Pushpa, blue flower, Kanda Visha, toxic properties in tuber, Kshubha, it is a shrub, Vatsanabi Agrati, like the umbilicus of a calf. Injection atropine is mainly used as antidote in acute poisoning of, answer is option B, Vatsanaba. Management of Vatsanaba antidotes in Ayurveda, Tangana and Grida or honey plus Grida plus Arjuna Tvak or Vavana. In modern, gastric lavage with warm water or potassium permanganate. Multiple doses of activated charcoal are given. Atropine 0.5 to 1 mg is given. Symptomatic treatment are also. Rhesus sardonicus is a feature seen in dash poisoning. So what is rhesus sardonicus? It is a contraction of the jaw and facial muscle with the corners of the mouth drawn leads to this condition. And this is seen in Kuchela poisoning. So, rhesus sardonicus is a facial expression that looks like a grin, but it is caused by the facial muscle spasm. So, this is also known as rictus grin. And the causes are tetanus, strychnine poisoning, Wilson's disease, malingering. Means a person may imitate the convulsion or a smile, but the fixed expression can't be maintained for long. Hysteria can cause contortions that indicate the cause. That has been reported after execution by hanging. So, this rhesus sardonicus is also reported after execution by hanging. So, these are the condition. The question here indicates to strychnine poisoning or Kubilo. Pleurostostomus. Pleurostotonus is dash of the body. It is a lateral bending of the body. So this is also known as a Pizza syndrome. Is a rare neurological disorder that causes involuntary muscle contraction in the trunk. This is characterized by abnormal posture such as the lateral bending of the trunk. Which of the following is the antidote of Kuchala? It is barbiturate. Antidote are barbiturate, phenobarbital, sodium can be administered intravenously. Muscle relaxants such as succinylcholine or curare, gastric lavage, tannic acid, strong tea or potassium permanganate can be used to wash out the stomach. Jambu seeds. According to the Ayurveda literature, jambu seeds can counter the toxicity of Kuchala. Usual fatal dose of Vatsanaba rhizome powder is 1 gram. Vatsanaba is a toxic plant that is used in Ayurvedic medicine, and this is also known as the queen of poisons. Overdosing or the accidental administration of Vatsanaba can cause toxic symptoms. The symptoms of poisoning include numbness in mouth and throat, vomiting, slurred breathing. The fatal dose is root 1 gram, extract 250 mg, alkaloid is 4 mg. English name of Vatsanaba. So we have different name: aconite, monk's hood, wolf's bane, leopard's bane, devil's helmet, blue rocket. Amongst them, here it is wolf's bane. Shodhana of Vatsanaba, Sthabana of Vatsanaba in Gomutra for 3 days. Or Dola Yandra Svedana in Godukta for 1 or 2 yama. Dola Yandra Svedana in Ajadukta for 1 yama. So these all are mentioned in Rasa Tarangini. Synonyms in Sanskrit: Visha, it is a poisonous herb. Amrita, act as a nectar if used in suitable doses after purification. Vatsanabi, Stogaga, Pranahara, and Shveda means consuming it causes unconsciousness. Gharala kills a person. These all are synonyms. Vatsanabo, Vatsanagaha, Shvedo, Astricha, Visham Madham, Amritancha, Tadheva Uktam, Rasatantra Visharadaihi. In Rasatarangini, these are the synonyms mentioned. Differential diagnosis for Kuchala poisoning is with tetanus. Differential diagnosis. So these are the differential diagnosis for the Kuchala poisoning. Epilepsy, it is distinguished by loss of consciousness and clonus. Hysteria, by the character of convulsion. Also tetanus. How we can distinguish between the strychnine and tetanus poisoning? Circumstantial evidence of poisoning by strychnine. Tetanus, history of injury. Sudden onset strychnine, but in tetanus, gradual onset. Strychnine, generalized convulsion, involve all muscle, whereas tetanus, lockjaw is an early manifestation. Fixation of the chest during convulsion in strychnine, not in tetanus. Complete relaxation between the seizure in strychnine, whereas tetanus, sustained rigidity between the convulsion. And death occur in a few hours or steady improvement is seen. But in tetanus, death is delayed for several days. And chemical analysis may reveal the poison in strychnine poisoning, whereas tetanus, that is not at all a poisoning. Kuchala, fatal dose is 15 to 30 mg of strychnine, that is the alkaloid content of 1 seed of Nux vomica. Lethal period is 1 to 2 hours. According to Rasa Tarangini, dash is a synonym of Kuchala. It is Visha Tindoga. Kuchala, it is a common name for the plant Strychnos nux vomica, and Visha Tinduga, it is a synonym for Kuchala, particularly mentioned in Rasa Tarangini text, meaning Visha means poisoning, Tinduga is a type of fruit. So Visha Tinduga translates to poisonous fruit. Pinpointed pupils are the toxicity feature of. Again, it is Ahifeina is the answer. Option A. So let's see opium. Opium is a dried juice of the white poppy, that is a Papaver somniferum, when the capsule is still on the plant. It is dark brown or black and has a peculiar smell and has a bitter taste. Poppy seeds are white, harmless, demulcent and nutritive and are used as food. Active principle, it has about 25 alkaloids, the major ones being phenanthrene, that is morphine, codeine and thebaine, isoquinolone, that is papaverine, narcotine and noscapine. And fatal dose is 2 gram morphine, 2 gram and morphine 0.2 gram, codeine 0.5 gram. Fatal period is 6 to 12 hours. And there is a clinical presentation. Stage 1 is stage of excitement and euphoria. That is, there is an increased sense of well-being, increased mental activity, flashing of face, convulsions are seen in children. Then stage 2 is stage of stupor, that is headache, nausea, vomiting, giddiness, lethargy, drowsiness, contracted pupil, cyanos face and itching all over the body. Stage of narcosis is a stage 3. deep coma, muscle relaxed, areflexia, pinpoint pupil not responding to light, hypotension, sweating, hypothermia, cyanosis, and froth at mouth or nose. And triad of coma, pinpoint pupil, and depressed respiration, 4 to 5 per minute, strongly suggests the opium poisoning. So, what is opioid overdose triad? Is a combination of three signs and symptoms that indicate an opioid overdose. So, pinpoint pupil, also known as pupillary miosis, unconsciousness, also known as drowsiness or decreased level of consciousness, respiratory depression, also known as hypoventilation or slowed or stopped breathing, are the triad for the opioid poisoning.